Vanakkam. Who says you cannot learn while having fun? Welcome to the Great TANPAPS Quiz, the infotainment program in the run-up to the annual conference of the Tamil Nadu and Pondicherry Association of Plastic Surgeons to be held from February 9 to 11, 2024.
Question number 1. Who was the first qualified plastic surgeon in Tamil Nadu? Dr. Samsi Bose, Dr. R. Venkataswamy, Dr. C. R. Sundararajan, Dr. Matangi Ramakrishnan. The correct answer is Dr. C. R. Sundararajan. Cheyyur Ramaswamy Sundararajan, known affectionately as Dr. CRS, got the honor of being the first of the 4 candidates selected for the first batch in 1961-62 for MCH in plastic surgery under Dr. C. Balakrishnan at Nagpur. He also holds the honor of being the first indigenous surgeon to acquire an MCH degree in any surgical specialty in the whole of India. He had the unique distinction of serving as president of both the Association of Plastic Surgeons of India in 1975 and Association of Surgeons of India in 1985. He was awarded the Dr. B.C. Roy Award in 1989. He started the Department of Plastic and Facial-Maxillary Surgery at Madras Medical College in 1963. It was the first plastic surgery department in South India. And when he started the MCH course in 1966, which was also a first in South India, his assistants Dr. Matangi and Dr. Nayak were taken in as the postgraduates. Question number 2. Which plastic surgeon from Tamil Nadu started a plastic surgery department on 26th January 1964? Dr. Samsi Bose, Dr. R. Venkataswamy, Dr. C. R. Sundararajan, Dr. Matangi Ramakrishnan. The correct answer is Dr. Samsi Bose. Dr. Samsi Bose got his MCH in plastic surgery from Nagpur and started in 1962. He started the plastic surgery department in Madurai on 26th January 1964 with 12 beds in the first floor of radiology block. The plastic surgery unit had the services of 3 plastic surgeons initially, Professor Samsi Bose, Dr. R. Venkataswamy and Dr. S. Jamal. Dr. Samsi Bose started the MCH course in plastic surgery at Madurai Medical College in 1978. He also served as President of the Association of Plastic Surgeons of India in 1978. Question number 3. What sesamoid bone develops in the tendon of flexor carpi ulnaris and is therefore not a part of the wrist joint? Capitate, lunate, triquetrum or pisiform? And the correct answer is the pisiform. The pisiform is a sesamoid bone with no covering membrane of periosteum. It is the last carpal bone to ossify. It is situated within the tendon of the flexor carpi ulnaris muscle and it articulates with the triquetrum alone. The name pisiform derives from the Latin pisum, which means pea, which resembles the shape and size of the pisiform bone. An interesting point about the evolution of this bone is that it is greatly reduced in size when compared with other non-human mammals. As you can see in the picture, the red coloring shows the pisiform bone in the earlier mammals and it shows the size of the pisiform bone in the humans. This reduction in the size of the pisiform allowed for more ulnar deviation and greater ulnar extension in the human wrist, which increased the capacity for throwing. There are other sesamoid bones in the hand. In decreasing order of frequency, there are 2 sesamoid bones in the distal portions of the first metacarpal bone, within the tendons of the adductor pollicis and the flexor pollicis brevis. There may be a sesamoid bone in the distal portion of the fifth and second metacarpal bones, and there may be a sesamoid bone in the distal portion of the proximal phalanx of the thumb. Question number 4. Who was the first plastic surgeon from Tamil Nadu to be recognized as international pioneer in hand surgery? Dr. G. Balakrishnan, Dr. R. Venkataswamy, Dr. S. Rajasabapati, Dr. H. Srinivasan. The correct answer is Dr. R. Venkataswamy. Dr. Ramaswamy Venkataswamy did his MCH in plastic surgery from Government Medical College Nagpur in 1967. In 1971, he organized the Department of Plastic Surgery and Reconstructive Hand Surgery in Government Stanley Hospital, Chennai. And in 1974, he established the 24-hour hand injury service, the first of its kind in India. He also started the MCH course in plastic surgery in the year 1978. He received the Pioneer of Hand Surgery Award in 2005, which was given by the International Federation of Societies for Surgery of the Hand. He was the first Indian plastic surgeon to get this recognition. Question number 5. Apart from the nasal septum, a chondromucosal graft can be harvested from upper lateral nasal cartilage, lower lateral nasal cartilage, quadrangular cartilage, alar cartilage. The correct answer is upper lateral nasal cartilage. In 1962, Millard published his work of repairing eyelid defect with a chondromucosal graft harvested from the nasal septum. The other region available for harvesting nasal chondromucosal graft is the upper lateral nasal cartilage, which was reported by Tessier in 1979. Question number 6. 90% of the volume of the nail is produced by sterile matrix, germinal matrix, hyponychium, or dorsal roof of nail fold. And the correct answer is the germinal matrix. The proximal part of the nail bed is the germinal matrix. The distal portion is known as the sterile matrix. The germinal matrix is responsible for 90% of the nail growth. The eponychium contributes to the shine of the nail. This eponychium is the part of the matrix on the dorsal roof of the nail fold. Question number 7. When there is disruption of the white roll without elevation of the cupid's bow peak in incomplete cleft lip, it is minor form cleft lip, microform cleft lip, mini microform cleft lip, macroform cleft lip. The correct answer is mini microform cleft lip. The term incomplete cleft lip presents in a spectrum. It could be a larger cleft like this with a very small intact skin band, or it could be a very small cleft as shown here. Ujira and Mulliken classified lesser forms of incomplete cleft lip into 3 types based on the degree of disruption at vermilion cutaneous junction. The 3 types are minor form cleft lip, microform cleft lip, mini microform cleft lip. Incomplete cleft lip is known as minor form cleft lip when the cleft extends for 3 to 5 millimeters above the normal cupid's bow peak, but it is less than 50% the normal cutaneous labial height. Deficient vermilion may be seen on the medial side of the cleft, and a cutaneous groove and muscular depression may also be seen. The median tubercle of the lip is usually hypoplastic, and there may be a minor nasal deformity. In microform cleft lip, there is a notched vermilion cutaneous junction, but the cupid's bow peak is elevated less than 3 mm above normal. In the mini microform cleft lip, there is a disruption of the white roll without elevation of the cupid's bow peak. There may be a notching of the free mucosal margin, and there may be a muscular depression noticeable below the nostril sill. Question number 8. The muscle shown in the diagram is abductor hallucis brevis, abductor pollicis brevis, abductor digiti minimi, flexor hallucis brevis. The correct answer is abductor hallucis brevis. Abductor digiti minimi and abductor hallucis brevis muscle flaps have a type 2 vascular pattern. The abductor hallucis brevis is on the medial side of the foot and abductor digiti minimi on the lateral side of the foot. The dominant pedicle of these muscles is at the level of the distal calcaneus, and hence these muscles can be harvested on their dominant proximal pedicles. These flaps are useful to fill small midfoot, rear foot and distal ankle defects. Question number 9. What is the golden ratio when expressed as a number? 1.618, 1.718, 1.818, 1.918. The correct answer is 1.618. The golden ratio is a proportion which was originally used in architecture and geometry. It represents the Fibonacci sequence. It is defined by a line divided into two unequal segments where the ratio of the entire line to the longer segment is identical to the ratio of the longer to the shorter segment, or 1.618. This number is known by the Greek alphabet phi. The idea of the golden proportion having application to facial analysis was popularized by Ricketts. The phi mask, which was devised based on this golden proportion, was innovated by Marquardt. Question number 10. Who was the first person to get MCH in plastic surgery from an institution in Tamil Nadu? Dr. Jamal, Dr. S. Rajendran, Dr. C. Gopalakrishnan, Dr. Matangi Ramakrishnan. The correct answer is Dr. Matangi Ramakrishnan. Dr. Karimpat Matangi Ramakrishnan was the first person to secure MCH degree in plastic surgery from an institution in Tamil Nadu. She went on to start the Department of Burns and Plastic Surgery at Government Kilpak Hospital in Chennai. Her advanced studies on post-burn scars fetched her the degree of Doctor of Science of the Tamil Nadu Dr. MGR Medical University in the year 1992. She was awarded the Dr. B.C. Roy National Award for establishing the specialty of burns in South India at the Kilpak Medical College Hospital. She served as president of APSI in 1988 and she was a Padma Shri awardee in the year 2002.
I hope you liked the video. I enjoyed making it. Please register for the TANPAPS 2024 conference, a wonderful scientific and academic feast where many innovative and interesting sessions are being planned. Do visit the website to see the details and to register. Vanakkam.